The presence of HCG, or human chorionic gonadotropin, in your system gives one of the first reliable indications you are pregnant, and HCG will appear in blood tests within 8 to 10 days of ovulation, usually the equivalent of 5 days after conception. HCG is essential to a pregnancy's healthy progression because it fosters production of progesterone, which keeps the uterine walls thick and vital. If a woman's body does not produce HCG, the uterine lining will dissolve as usual and menstrual flow will follow. Normal and elevated are relative terms in measurement of HCG levels. If you aggressively are working to get pregnant, your fertility specialist probably has you tracking your ovulation and will test your HCG daily for at least a week after your temperature rises and your body gives other signs of an egg's passage through your fallopian tube and into your uterus. Your HCG level on the day you ovulate will set your own personal baseline, and subsequent readings will indicate whether you are pregnant and how well your pregnancy is advancing. Some fertility drugs contain HCG, triggering abnormally high readings, but your specialist will explain how she adjusts for drug-influenced HCG levels as she reads your test results. If you are at risk of miscarriage or complications of pregnancy, your HCG levels will give the most reliable indicators of your health during the first 4 to 6 weeks after conception. Low levels of HCG will prompt your OBGYN to monitor you for up to 8 weeks, looking for ectopic pregnancy or the possibility of miscarriage. Many perfectly healthy pregnancies, however, do not show rapid gains in HCG levels, and your own HCG level may vary from one pregnancy to the next. High HCG levels typically indicate simply that you miscalculated the date of your ovulation, and your pregnancy is slightly more advanced than you thought. In extreme cases, though, exceptionally high HCG measurements may indicate either molar pregnancy or multiple births. If you took fertility drugs and then did in vitro fertilization, high HCG readings almost always indicate multiple births. Working with your fertility specialist and OBGYN to assure your own and your baby's health, you must recognize 2 important facts. First, HCG measurement is a testing and diagnostic procedure intended to monitor your progress. HCG testing is just one among several techniques for monitoring your progress, and it does not alter the course of the egg's attachment or the embryo's development. Doctors have no effective intervention for preventing miscarriage. Second, 1 in every 5 pregnancies ends in miscarriage within 45 days of conception. Monitoring HCG levels help prevent ruptures of ectopic pregnancies, and in cases of failure to progress, it can minimize the risks associated with dilatation and curettage. During pregnancy, your HCG levels normally will double approximately every 72 hours, but your rates may vary dramatically. Doctors typically regard levels above 1500 IU the threshold for ruling out ectopic pregnancy, and when you reach that level, your doctor will probably suspend HCG testing, preferring vaginal sonography. Once she detects your gestational sac, your OBGYN will depend exclusively on sonograms for monitoring your progress.